Earlier, we discussed how blood pressure changes throughout a person's lifetime. In fact, blood pressure also exhibits significant circadian rhythmic changes throughout the day. These changes are determined by a combination of physiological needs, activity levels, and nervous system regulation. Now, let's discuss how blood pressure changes throughout the day. We'll start with the morning, which is a critical time for blood pressure changes. When a person first wakes up, the sympathetic nervous system becomes active, and the body transitions from a resting state to an active state. At this time, heart rate accelerates, blood vessels constrict, leading to a natural rise in blood pressure. After morning, the body enters the daytime period, during which blood pressure typically shows a sustained upward trend. Especially during daily activities, exercise, or when responding to various external stimuli, heart rate accelerates, the sympathetic nervous system becomes active, blood vessels constrict, and blood pressure remains at a higher level. As evening approaches and evening activities decrease, the body begins to enter a resting state. At this point, the activity of the sympathetic nervous system gradually decreases, and the parasympathetic nervous system begins to dominate. The parasympathetic nervous system relaxes the body, slows the heart rate, and helps dilate blood vessels. Through the regulation of the parasympathetic nervous system, blood pressure begins to slowly decrease. The body enters a rest and recovery mode, preparing for deep sleep at night. During the late night, especially when entering the deep sleep phase, blood pressure typically drops to its lowest point of the day. This occurs because during late night hours, the body is fully relaxed, heart rate slows, sympathetic nervous system activity decreases, blood vessels remain dilated, and blood flow becomes smoother. As a result, blood pressure is relatively low.